So I'm Dr. Deborah Wilson. I work in rural Tasmania in one of the smallest hospitals in Tasmania. I've been giving anaesthetics for over 30 years and I've been working in the rural area in Tasmania for over 26 years. Well, I always say I'm an anaesthetist, but my mother used to say to me, I don't know why I haven't chosen a profession that I can pronounce and spell. So it is quite confusing for people. Generally, I would say that I look after people and keep them safe while they're having their surgery, just in very simple terms. We are highly trained professionals, and I always introduce myself as, I'm the anaesthetic doctor and we'll be here looking after you, keeping you safe during your procedure. So the patients generally are pretty vulnerable and anxious when they come to anaesthesia. They've been given a lot of information, and sometimes, particularly where I work in quite a low socioeconomic area, health literacy is low, so there's often a lot of information overload. So I try and establish some sort of rapport with the patients. One of the things I really love about anaesthesia is the people, and I particularly love the patients. They've all got a story. I do a lot of elderly patients. They've always got a story about their life. They tell me what they're planting in their garden. So I try and start with establishing some sort of rapport, and then obviously asking them about their health and explaining why that's important. I need to understand more about your health history so that I can keep you safe during your anaesthetic. And then I try and explain to them in simple terms what their risks are, and their risks in context for their particular illnesses, for the surgery that they're having, and for the setting in which that's occurring. That's quite important in rural areas because sometimes we have very sick patients that we have to go ahead and operate on, even though ideally they may be having their surgery in a bigger centre, but it's time critical and we have to go ahead and do the best we can. So I think the personality traits that make a good anaesthetist, and I've thought a lot about that, I think empathy and compassion are really important, because I think you need to have that empathy and compassion with the patient. So I think that's really important to kind of understand how they're feeling. I think to work with the team, you need to have good communication skills. So, and often, the anaesthetist is the one that kind of organises all of the team, organises the surgeons, organises the nursing staff, organises the orderlies. So you need to, in a way, be the team leader and have really good communication skills so that you can keep the team working together for the common good of the patient. And, sometimes I have to say to the team, okay guys, let's just stop and let's think about what's best for the patient. So I think that ability to communicate is really important. And you do have to have some appetite for risk, and you have to have some feeling that you can manage in that sort of risk environment. Most of the time anaesthesia is not risky, and we compartmentalise risk, but the nature of what we do, there's always risk. And so you do need to have a bit of that part of your personality that embraces risk and is happy to work in an environment where you will be faced with that kind of risk stratification, modification, and have to deal with that. What excites me about anaesthesia is that ability to feel like you can give back to the community and you can actually make a difference to people, and particularly can make difference to people on an individual level. So people can come in, they can be extremely anxious. For them, it can be a life-changing operation, which may be either good or bad. And so, I'm still excited by the fact that I can work with that patient and I can make them feel comfortable and safe during their anaesthetic. And I just love the theatre environment. I love the team, so you're part of a team. And in a rural community, a lot of the people I've worked with for 25 years, we've seen our families grow up together. We've had Christmas functions together for umpteen years and so forth. We've seen bureaucracy come and go, but we're all, stay together as a team. So I still feel excited about that part of our career, to be part of such a team and to be able to give back to the community and really kind of make a difference. You can make a huge difference in rural communities, and generally they are very underserved. So, 26 years of working in a rural area has been extremely rewarding. And it also gives you opportunity to do lots of other things as well, more so than perhaps if you're working in a metropolitan area. So I've been involved a lot with teaching medical students, so trying to train up the next generation, teaching our anaesthetic registrars, and then I've been involved with the Anaesthetic College from a governance perspective, trying to help to train up and to select and to get the right people into anaesthesia so that we'll have a rural workforce into the future. And the other thing that's really nice about working in the country is there is a lot of variety. So, in the morning you might be doing children to have their tonsils and adenoids, and then you might do the orthopaedic list with a 100-year-old, patient having their neck or femur repaired or whatever. So, and you do a bit of obstetrics, and you kind of have to be a jack of all trades, and so that's really interesting. It's challenging because you need to keep up to date with a lot of aspects of anaesthesia, but at the same time it can be very rewarding, and the work is very varied.